from the station that's working for you. You're watching Fox 4 News at 5.
If you've got symptoms that would be concerning, then certainly to reach out for care and testing.
Care and testing, because another public health concern is making the rounds in the metro. 49 patients in Wyandotte County are being treated for TB. Infectious disease specialists in the metro consider that an outbreak. I'm John Holt.
I'm Bria Love. This is more tuberculosis cases than seen in all of 2023. Public health leaders in Kansas City, Kansas say it is a big concern. Fox 4's Sean McDowell working for you live outside of the Wyandotte County Health Department tonight. And Sean, we understand this is a concern, but it's not the same conditions as we saw during the pandemic.
That's a good word to say it. And in fairness, Bria, there are also 7 cases of concern in Johnson County. An infectious disease doctor in the metro told Fox 4 News earlier today that this is a concern because Wyandotte County wouldn't typically see this many active TB cases in a full year, much less 8 months. However, this is not reason to panic because tuberculosis does not spread as easily as other diseases might.
TB is not like COVID.
It's serious, but the potential for infection with tuberculosis isn't as high as other public health issues. 49 cases of this bacterial infection are enough to have doctors in the metro sounding an alarm. It's spread through the air when people speak or cough. The Mayo Clinic says high fever is a common symptom with TB. So are chest pain, fever or chills, weight loss, a persistent cough, which can sometimes deliver blood or mucus, and night sweats are all indicators that a patient should seek a doctor's care.
Information is power, and that this is a disease that's circulating right now.
Dr. Jenny Bose is the director of infection prevention at St. Luke's Health System. She says the general public is at low risk for developing these symptoms, and it's unlikely we'd see a major outbreak like the pandemic delivered.
If you've got symptoms that would be concerning, then certainly to reach out for care and testing.
Dr. Bose expects the Wyandotte County Health Department to conduct contact tracing since the origin of this outbreak will be hard to find.
The key is to get on a robust treatment program, that they'll get that through the health department and through their physician.
The Kansas Department of Health and Environment is concerned about the 75 current cases it's aware of in the state. A spokesperson for that agency encourages symptomatic patients to get tested, but overall, there's no reason for public panic. Jill Brunauer, spokesperson for the KDHE, told Fox 4 News on Friday, quote, "There's very low risk of infection to the general public. However, we are working with the Wyandotte County Public Health Department and the Johnson County Department of Health and Environment to ensure patients are receiving appropriate treatment." It is also possible to have a latent case of tuberculosis. That means the person who's infected carries the infection, the bacteria in this case, but they don't show any symptoms because their already built-in immune system is doing a good job of fighting it off. However, the big concern comes from the fact that tuberculosis can be deadly if it's left untreated, that according to the World Health Organization. Sean McDowell, Fox 4, working for you live in Wyandotte County.